Hi, I'm Ben Massenberg, a plastic surgery resident at the University of Washington, and I'm here with Professor Jong Woo Choi, the chair of plastic and reconstructive surgery at Asan Medical Center in Seoul, South Korea. Welcome, and thank you for joining us today, Dr. Choi.
Yeah, me too. Yeah.
So today we'll be talking about the advances in orthognathic surgery, particularly with care pathways and protocols with traditional pre-surgical orthodontics or surgery first orthognathic surgery. To start our discussion, what do you think has been the largest paradigm shift in orthognathic planning and treatment for patients with skeletal malocclusion and or facial asymmetries?
Yeah. Although the surgery first approach without pre-surgical orthodontic treatment might sound too aggressive one, but according to my 17 years experience, actually, it turned out work quite well in selected cases. Actually, in my practice, more than 75% the patients are undergoing the surgery first approach, but not all the patients cannot be a candidate for the surgery first approach. So based on the sophisticated the dental model setup, we will decide whether we go on the surgery first or not. So first of all, it could be regarded as a paradigm shift in the orthodontic surgery approach. So, but we have few things to consider. Yeah.
Yeah, and in your practice, what's the ideal patient for you to kind of pursue that surgery first approach to orthognathic surgery?
Yes. So actually, the class 3 dentofacial deformity. And actually, our next would be the facial asymmetry patients. So actually, so far, actually, these two the patient groups actually could get many benefits from the surgery first approach. However, the pitfall is a class 2 malocclusion patients. So in class 2 patient, in class 2 dentofacial deformity, if we do the surgery first approach without pre-surgical orthodontic treatment, we'll get the crossbite like this. So it's a little difficult to overcome the post-operatively. So that's why we are a little reluctant to apply the surgery first approach in class 2 dentofacial deformity.
Yeah. And besides class 2 malocclusion, are there any other categories of patients for whom you would not offer a surgery first approach, like segmental maxillary movements or syndromic or cleft patients?
Yeah, because actually, in order to expand the transverse dimension of the maxilla, so actually sometimes we need to the segmental osteotomy of the maxilla, as you mentioned. But actually, for that patients, actually, we don't need to apply the surgery first approach. We could do, but actually, benefits and then disadvantages. So I think it could be decided on the opinion, not only the surgeon, but also the patient. And actually, regarding the cleft patients, since we have been managing the cleft patients since their childhood, so we have really a long period of the time. So in our practice, actually, we are not that the aggressive in applying the surgery first approach in cleft patient because we have enough time for the pre-surgical orthodontic treatment already. So mostly I'm following the traditional approach in cleft patients.
Right. And as the patients for orthognathic surgery traditionally are coming through the orthodontist,
Yeah.
what recommendations would you have for a surgeon that wanted to implement kind of a surgery first orthognathic approach in their practice?
Actually, in Korea, the surgery first approach became a kind of trend in early 2000, the 2010s. So actually, it changed the trends of the market. So not of the medical market. So as you mentioned, the most patients came to me via orthodontist in the past, but recently the patients comes first to me, my clinic. So actually the surgeon, the maxillofacial surgeon and plastic surgeon can decide when the patient undergo the operations. And then I refer my patient to the various orthodontists. So
Wow.
actually it could be regarded as a surgeon-initiated approach. And in addition, most importantly, it could be regarded as a patient-oriented approach. So patient can select the surgeons, and then actually the orthodontist can help us. So then most importantly, patient can decide when to undergo the operations. So not in all cases, but in many cases, actually that kind of trend changes became reality in Korea.
That's very interesting.
Yeah.
And there have been so many advances in orthognathic surgery, like moving from traditional stone model surgery to virtual surgical planning with custom fabricated splints and even custom plates. Where do you think we're heading as a field in the future for orthognathic surgery?
Yeah, so actually, in my practice, more than the 10 years, I've been applying the virtual surgical planning in orthodontic surgery. Actually, without that, I could get the decent result, which not that different from the virtual surgical model-based approach. But especially in facial asymmetry correction, actually, I could get the really great benefit from the virtual surgical planning. And actually, the one thing is actually difficult part is especially in Korea, we prefer the jaw rotational orthodontic approach. So without advancement of the maxilla. So actually, mostly the aesthetic orthodontic surgery depends on PNS impaction. So actually, customize the plate cannot provide enough fixation or the bony security, so there is some limit in applying the custom-made plate in our practice. In addition, the surgery first approach actually from the stone metal to the digital model. The difficult part is actually in surgery first, the dental model setup. We are using the separating all teeth while mimicking the pre-surgical treatment on the model. So that kind of process takes up quite a longer time in digital situation. So we are developing that kind of the program currently.
That's exciting. Well, I look forward to seeing
Yeah.
that software come out and kind of the continued advancements that your group is making.
Yeah.
And thank you so much for chatting with us today. I look forward to seeing you at the meeting in September.
Yeah. So I will. I'm really looking forward to seeing all my friends again in Seattle.
Perfect. Thank you so much.
Thank you.